Good afternoon. My name is Denitra Bovan. Although primary care is often thought of as a setting which includes a building in which the patient visits the health care provider, primary care doesn't have to be confined to the four corners of a building. A practice that actively engages in community outreach efforts has the ability to not only provide care to their patients in the community and potentially recruit new patients, but also to have a positive impact on their community. This can be achieved through the creation of health and wellness initiatives like a community event which promotes preventive services such as mobile mammogram units. Inspiration for Singleton Health Center to have a community event. I noticed whenever insurance providers sent star ratings or gaps in care reports for our practice that preventive screenings such as mammograms, wellness exams, and colonoscopies had higher rates of noncompliance than other measures. I was also well aware that certain diseases have a far more adverse impact on rural communities. Breast cancer is one of those diseases. It was my thought process that if I could personalize the mammogram screening and make it more of a social event, that the patients would be more likely to complete the screening. With permission from our medical director and office manager, I organized our first annual Breast Cancer Awareness Day last October. Breast Cancer Awareness Day was created as one of our health and wellness initiatives in which our practice educated our patients on breast cancer awareness and preventive measures. It also doubled as an event in which our practice was able to close gaps in care for other preventive screenings. Patients were able to schedule a mammogram and a wellness exam on the same day as the event. Considerations for your event. In an effort to effectively engage our patients and being active participants in their health, I partner our practice with the Regional Medical Center Breast Health Center's mobile mammogram unit. Initially, I planned to have the mobile unit come out annually during the month of October for Breast Cancer Awareness Month. However, the response from patients who completed their mammogram at last year's event and patients who heard about the event was so overwhelmingly positive that I decided it would be a good idea to have the mobile mammogram event more than once a year. As a result, I requested and received permission from our medical director to have the mobile mammogram visit our practice 3 times. Yes, ma'am.
Okay.
Yes, ma'am.
Okay, so if you remember the last, hold on just a minute. Good afternoon. Welcome to the Center for Practice Transformations Rural Training Series for Best Chance Network and WISEWOMAN. The focus of today's webinar and training is planning Best Chance Network and WISEWOMAN screening events, tips for success. This is a partnership between the South Carolina Office of Rural Health, the DHEC's Best Chance Network, and WISEWOMAN programs. This training series has been sponsored by grant funds from the Centers for Disease Control in Atlanta, Georgia. I am Tiffany Simpson-Crumpley, and I am your moderator for today. And our guest presenter is Denitra Bovan. She is a data analyst with Singleton Health Center and has a wealth of knowledge and experience for planning these events. So, what to expect for today? By the end of this webinar, participants will learn the steps to plan a successful community screening event, review activating EHR patient screening reminders, which is the foundation for bringing folks out to your event. Just a quick review. Leading up to this series of trainings, we gave you basic knowledge about how to implement an effective Best Chance Network program. Denitra joined us previously for how to set up your EHR to engage patients for your BCN program. We've also had a focus on billing, the basics of customer service training and our front desk training, and then we launched immediately into the WISEWOMAN program focus. And we gave you an overview of WISEWOMAN, making the case for WISEWOMAN for rural providers to participate in the program, and also other key aspects of the WISEWOMAN program, such as diabetes prevention and weight management services, and specific billing technique to maximize your revenue for WISEWOMAN. Just a quick review about what Best Chance Network is. Best Chance Network has been around for nearly 30 years in this, since 1991, and the Best Chance Network is South Carolina's program for the National Breast and Cervical Cancer early detection screening program. It provides comprehensive screening and diagnostic services for low-income, uninsured, and underinsured women across the state. In the community, it is commonly referred to as the free mammogram program, but it provides other services as well, such as your pap smear and a comprehensive breast exam, along with access to mammogram services. In order to qualify for Best Chance Network services, a woman must live in South Carolina, be 30 to 64 years old, not have health insurance or is underinsured, meaning they only have hospital coverage, or a high deductible of $1,000 or higher. And also, you have to meet income eligibility guidelines, and those guidelines are available at the DHEC website. Starting in July of this year, women as young as 21 can qualify for cervical cancer screening. What is the Wise Woman program? Well, I like to refer to the Wise Woman program as the second component of a dynamic duo of comprehensive health services for the uninsured woman. The focus of the Wise Woman program is to reduce risk factors for heart disease in low-income women 40 to 64 years of age. In this program, women can receive cardiovascular disease screening, health coaching, and lifestyle changes with a focus on controlling high blood pressure. And a program must first be a Best Chance Network provider before they can add on the Wise Woman program to serve women. As we prepared for this training series, we interviewed over 20 programs across the state of South Carolina, and there are critical building blocks of a BCN as well as a Wise Woman program. Every practice or health clinic must have a practice champion or a health coach that oversees, and it is their primary responsibility to activate the program within the practice. Everyone from the clinician to the front desk person must have a defined team role in the service program process. Also, having working knowledge of your electronic health record system, knowing how to set up electronic screening reminders, and as a companion to that, also using cell phone text alerts to remind patients that they are due for screenings. And most of all, in addition to providing a patient with high quality health care service, you want to also be able to maximize your revenue. So for a successful BCN program to serve women, you also must have billing and coding knowledge to maximize revenue for your practice. I'd like to introduce you once again to Denitra Bovane. She is a data analyst with Singleton Family Health Center. She is a native of Orangeburg, South Carolina, a proud veteran of the U.S. Marine Corps, and a graduate of Claflin University. And today she's going to share her knowledge and expertise with putting on screening events. Denitra, I turn it over to you.
Good afternoon. My name is Denitra Bovane. Although primary care is often thought of as a setting which includes a building in which patients visit the health care provider, primary care doesn't have to be confined to the four corners of a building. A practice that actively engages in community outreach efforts has the ability to not only provide care to their patients in the community and potentially recruit new patients, but also to have a positive impact on their community. This can be achieved through the creation of health and wellness initiatives like a community event, which promotes preventive services such as mobile mammogram events. Inspiration for Singleton Health Center to have a community event. I noticed whenever insurance providers sent star ratings or gaps in care reports for our practice that preventive screenings such as mammograms, wellness exams, and colonoscopies had higher rates of noncompliance than other measures. I am well aware that certain diseases have a far more adverse impact on rural communities. Breast cancer is one of those diseases. It was my thought process that if I could personalize the mammogram screening and make it more of a social event, that the patients would be more likely to complete the screening. With permission from our medical director and office manager, I organized our first annual Breast Cancer Awareness Day last October. Breast Cancer Awareness Day was created as one of our health and wellness initiatives in which our practice educated our patients on breast cancer awareness and preventive measures. It also doubled as an event in which our practice was able to close gaps in care for other preventive screenings. Patients were able to schedule a mammogram and annual wellness exam on the same day as the event. Considerations. In an effort to effectively engage our patients in being active participants in their health, I partner our practice with the Regional Medical Center Breast Health Center's mobile mammogram unit. Initially, I plan to have the mobile unit come out annually during the month of October for Breast Cancer Awareness Month. However, the response from patients who completed their mammogram at last year's event and patients who heard about the event was so overwhelmingly positive that I decided it would be a good idea to have the mobile mammogram event more than once a year. As a result, I requested and received permission from our medical director to have the mobile mammogram visit our practice 3 times this year, with the last mobile mammogram event scheduled for October 30th. Although there is a facility approximately 700 yards from our practice that patients can use to complete their mammograms, some of our patients have stated they enjoy having the mobile unit directly in front of their doctor's office and the personalization associated with using the mobile unit. Each patient receives 2 telephone reminder calls and a written and signed reminder in the mail and a handwritten thank you note from me within 2 weeks of completing their mammogram. The dates of the mobile mammogram will occur during the last full week of the designated month. Appointments start at 9 and end whenever our last patient has completed her event. Event planning. Planning our mobile mammogram event is an act of love for me. I genuinely love calling our patients to schedule their appointments, sending them their reminders, and most of all, greeting and conversing with them on the day of their screening. I used the following action plan for when I created our first annual breast cancer awareness date. Choose a date. The date you choose should be one in which you do not have any other obligations. I would recommend not scheduling the event the day before or a day following a holiday. There's a greater possibility for no-shows. Location, location, location. Your event should be in a location that is easily accessible for your patients and one that they are familiar with. For our practice, the mobile unit is parked directly across from our office. Research and decide who to partner with. I chose to partner with our local hospital because they have a mobile mammogram unit. I got to know the mammogram tech that is responsible for the mobile unit and cultivated an excellent working relationship with her. I also partnered with South Carolina Office of Rural Health, United Healthcare, Molina, Humana, Amethyst Home Health, and New Hope Travel and Ministry, all of whom donated items for our event's swag bags. These items included pins, notepads, keychains, planners, gift cards, and other items promoting breast cancer awareness, as well as overall health and wellness awareness. Additionally, I partnered with Best Chance Network and the Breast Boutique, who sent representatives to support our event. Get your practice excited about the event. There were several co-workers who were very supportive of the event. Some donated items and our money. Others volunteered their talents by creating items to be placed in the swag bag or baking treats for the event. Some promoted the event on their personal Facebook page, and most of the office wore pink on that day. Allocate time during your day for planning the event. For me, it's easier to plan for an event if I have scheduled blocks of time specifically dedicated to the event in my agenda and adhere to it as much as possible. I would recommend allotting 1 to 2 hours, 3 days a week. This gives you enough time to have brief but meaningful conversations with the patients while reminding them to get their mammogram. I have found that patients respond far more favorably when I engage in conversation with them prior to stating the purpose of my call. In keeping with the 3-day schedule or whatever works best for you, try to have at least one day in which you plan the logistics of your event, things like decoration, booth settings. Promote your event. Last year's event was promoted on our practice official Facebook page as well as the personal pages of several of our employees, on the television screen in the patient lobby, in the calendar events in the Times and Democrat, which is our local newspaper, and through our patient portal. This year's event promotion will build upon last year's strategy to include the use of PSAs on a local radio station. Associated cost and beneficial value. The event has the possibility of having little to no associated costs. This is heavily dependent on what you determine your budget to be. For the first event last year, where swag bags and a snack table were used, the total cost to me was approximately $45. To reduce costs, I suggest actively looking for sponsors and our partnerships. As previously stated, I partnered with South Carolina Office of Rural Health, United Healthcare, Molina, Humana, Amethyst Home Health, and New Hope Traveling Ministry and asked each organization if they would be willing to donate items for the swag bags. I also asked a coworker who is a great baker and crafter if she would assist. There were also coworkers who donated money and food items for our snack table. For the Breast Cancer Awareness Day this year, my total cost will be $0 because I've secured sponsors to cover the items I purchased last year. For the two mobile mammogram events we had this year in February and May, the total associated cost was $26. This was the cost of thank you notes and stamps. The beneficial value cannot be quantified. This event allows patients to complete needed preventive screenings, which allows them to be proactive in their health management, and our practice to improve its star rating with insurance providers and ensures we are adhering to HEDIS measurement goals. Strategy for identifying women eternally. Within our EHR, we have the capability to customize reports, which will provide a list of patients based upon specific characteristics of a targeted demographic for an internal care gap report. For example, if my target demographic is women who need a mammogram, I would want a registry report with the following criteria: gender, female, age range 40 to 65, date, typically I choose the previous year, ICD code Z12.31, subset not. This will give me a list of females between the ages of 40 to 65 who do not have a mammogram ICD code in their assessment list. This, however, does not mean the patient did not have a mammogram. From that list, I check the patient document sections of the record to see if the results of a mammogram are in the patient's record. If mammogram results are there, I remove the patient from the care gap report. If there are not any mammogram results, I call the patient and inquire if she has completed her mammogram. Sometimes a patient has completed a mammogram, but it was ordered by her OBGYN. If a patient tells me this, I ask them the month and year of the exam as well as the name of the facility. With that information, I compile a list and give it to our medical records clerk, who requests the results from our practice. Once the results are received, they are scanned into our EHR and the patient is removed from the report. If the patient has not completed the mammogram, I inquire what facility she would like to have her mammogram and start the referral process in our EHR. After entering the basic information, I assign the mammogram referral to our referral coordinator, who contacts the facility, schedules the appointment, and contacts the patient with the date and time of her appointment. I also inform the patient of our mobile mammogram event and inquire if she would prefer to use it. Providers are made aware of the mobile mammogram dates and asked to inform their patients when they come in for an office visit. The providers usually send me an action notification or a telephone encounter through our EHR for a specific patient. On occasions, providers will stop by my desk and tell me the name of a patient. Strategy for follow-up and retaining women screened in your medical home. I create a master list for all the women who use our mobile mammogram unit. As previously stated, those patients receive a handwritten thank you note from me. Additionally, those patients receive a just checking on you call 6 months after their mammogram and will receive a call to schedule their mammogram a year after their initial one. All female patients who fall between the parameters for an annual mammogram receive an annual reminder call. Our EHR has a call campaign service which identifies all females in need of a mammogram. Those patients identified will receive an automated phone call reminding them of the importance of screening an annual event. Electronic reminders. Advancements in healthcare information technology have made it possible to improve quality and efficiency through the use of effective patient engagement tools in the primary care setting. One of the ways in which this is best utilized is through the use of electronic reminders for not only the office appointments, but for preventive services. I have implemented the use of electronic reminders for preventive screenings like mammograms for our practice. Electronic mammogram reminders are sent quarterly through our EHR. It's a good idea to have your reminder message typed and saved in a Microsoft Word document prior to creating the reminder in your EHR. The reminder messages will be received by all patients who are web-enabled. This means every patient with an email address on file, a patient portal account, and/or a Helo app account will receive the message. If your practice uses a patient portal, it is also a good idea to place a portion of the reminder within the welcome message of your patient portal. To maximize our ability to reach our patients electronically, It is required to enter an email address when creating a patient record. If the patient does not have an email or does not want to provide an email, the not provided box must be checked and the reason for the drop-down box must be selected. To ensure office staff complies with this rule, I contacted our EHR provider, eClinicalWorks, and instructed them to add email address to the mandatory field. This means a new patient record cannot be saved until the email address field is completed. For established patients, if the email address is not on file, once the record is open, it cannot be closed until the email address field is completed. Women served. There have been a total of 3 mobile mammogram events with another scheduled for October 30th. For those 3 events, 55 patients have been scheduled for mammograms, with 35 patients completing their mammogram on the scheduled date. This equals a total completion rate of 63%. Of the 20 patients who did not complete their mammogram on the scheduled date, 2 rescheduled for future mobile mammogram events, 10 rescheduled to a brick-and-mortar facility, and 8 were complete no-shows. Although only patients with orders submitted prior to the day of the event can have a mammogram on the specified date, our event is open to the public. I have information for Best Chance Network available and the Breast Boutique available as well, and I give them to our patients and to anyone that stops by the mobile unit.
Thanks, Denitra, for sharing your expertise around mobile screening events. I'd like to share information learned from a Wise Woman program interview at Clemson University. The Joseph F. Sullivan Center, which is a free clinic up at Clemson University, shared these tips for success. They first said, number 1, pre-qualify patients via phone call prior to mobile screening events to reduce unnecessary paperwork and time spent with that during the day of the event. Create 2 to 3 hour appointment slots where women can be served comprehensively for Best Chance Network and Wise Woman services. So yes, correct, you can have a screening event where you provide breast cancer and cervical cancer screenings as well as Wise Woman, but you need to block out the time for it and alert your patients accordingly. Also, it's helpful to integrate your forms into your EHR. So the forms that you must, the information that you must intake on Wise Woman intake forms as much as possible, have them be a part of your electronic health record system to avoid duplication of efforts. And also, consider using nursing and allied health centers from your local technical colleges and universities to support your event in terms of patient navigation and helping patients navigate the process. The benefits of becoming a rural provider for BCN and Wise Woman. You can earn increased revenue from initial screening and follow-up appointments from the BCN and Wise Woman programs. For Wise Woman, patients can receive free diabetes education and lifestyle coaching to promote healthy eating and physical activity. Also, screening, intervention, and health coaching aligns with other practice improvement measures such as the Patient-Centered Medical Home Program, meeting the mark with your HEDIS measures, as well as the Physician Quality Reporting System, and as well as increased incentives through the Medicare Merit-Based Incentive Program, or MIPS, or what's also referred to as the QPP program. So what do we want you to do? If you are not a BCN provider, definitely consider becoming a provider. That is the first step to being able to provide comprehensive services for uninsured women. And to really think about it, if you're seeing an uninsured woman, you're probably going to be doing these services anyway. So why not be reimbursed for it? So the first step is to become a Best Chance Network provider. And this year, you can, for existing Best Chance Network providers, you can become a Wise Woman provider, and it will be just added as an additional service for your contract renewal with DHEC. Also, the most important thing is to designate a member of your staff to become a health coach. So, Denitra, I have just a couple of questions for you. If I am a practice and I'm not a best chance network provider, should I go ahead and plan a screening event? And what advice would you recommend to those listening who may not quite be ready to be a BCN provider but want to do a screening event?
I would definitely recommend still doing the screening events because it's of beneficial value to your practice and to your patients. My best advice would be to definitely decide who do you want to partner with, because having a good partnership will ensure that your event goes smoothly. Plan well in advance is not something you can throw together in 2 or 3 weeks. Proper planning will ensure that your event sails smoothly. And definitely call your patients and make sure that they're going to show up. For regional medical center, their mobile mammogram requires that you have at least 10 people to come out to your event. I always schedule between 20 to 25 in the event that there are some no-shows. That will prevent it from being a total loss. So if you only scheduled the 10 that they recommend and 5 showed up, that's 50%. But if you scheduled 20, 25 and 20 out of 25 show up, that's a higher success rate. So yes, even if you're on a best chance network, I would definitely recommend still doing the events. Patients appreciate it.
And what is the lead time? You said this is not something that, I think you stated it earlier, but could you restate like how much time? So for example, if you wanted to have a screening event in October for Breast Cancer Awareness Month, how far in advance is really a good rule of thumb to plan?
At least 2 to 3 months in advance. But the more time, the longer you take to plan it, say if it's in October and you started planning in February, March timeframe, by August everything is already together, which is what case for me. I started in advance, a few months in advance, and it gives you more time to secure your sponsors, to secure donations, to whatever you're going to order for the event, to already have it together.
That's
so
definitely.
It's good if you give yourself that little bit of cushion.
Okay, so there you have it. So give yourself 3 months time. And in terms of your first line of fire, in terms of determining who will be your mammogram provider, I would contact your local hospital. Most of your major hospital systems already have mobile units, so it may very well be a simple phone call to your hospital partner, and most definitely dedicating a day for screening only. So it's very important not to try to mix other services, because you'll really be focused on not only the women in your practice, but also community members that might show up and don't have a medical home. So not only can you screen them, but they can also establish a medical home with your practice. So great information. So the South Carolina Office of Rural Health, in addition to providing these trainings, is definitely here to help rural practices in other areas. If you are interested in becoming a patient-centered medical home, there is a team of quality improvement coaches that can help you earn that accreditation and help you with that process. Also, with the new Medicare Merit-Based Incentive Program, also known as the Quality Payment Program, there's technical assistance provided for that as well. If you are a federally designated rural health clinic, we also have expertise to maintain your designation as a RHC, but also giving you coding and billing advice to maximize your revenue. As always, here are the resources that are available to you. Trinessa Jones is the director of the Best Chance Network program, and her information is provided, as well as Linda Peckery, who is the Wise Woman program manager. I am Tiffany Simpson-Crumpley. I'm your education and training consultant and moderator for this series, and LaShonda Pettaway Brown is a QI coach that has expertise in internal operations for these type of programs. I thank you so much for your time today, and if you have any questions, we will be sharing Denitra's contact information with you. Is that okay if people reach out to you and ask questions via email?
Yes, ma'am.
Okay, well, I thank you for joining us today. Be sure to take the quiz just to make sure that you caught all the good facts on this training series. And if you have any questions, we will have Denitra's information available to you. Thank you for joining me this afternoon. And I look forward to you all having awesome screening events that save lives. Have a good day.